Hello, ladies. How are you guys? We have quite the crew tonight. I'm super, like, I'm really excited to talk to you guys tonight. Uh, a lot of reasons, but anytime I talk about the topic of cancer, I just get very emotional and I get very real with you guys, and that's what I'm planning to do tonight. So I'm not going to promise I'm not going to cry. I'm not going to promise that I might get a little animated. I'm not going to promise that I don't know what's going to happen. We'll see. We're going to go with the flow. I have a lot to talk with you guys about. I do want to leave some time at the end for some questions, but the best way to get your questions answered will be to join me. Well, I have a special invite for you where you can actually talk to me. But anyway, so who do we got on? Marta. Yeah, Marta's like, the music makes her want to bounce on a rebounder. I know, right? It's a good beat. Hi, Kelly and John. Hi, Susan. Hi, Lisa. Hi, we have two Susans, okay? Hi, AJ. Hi, Nancy. Debbie, two Debbies. Hi, Irene. Hi, Jacqueline. Hi, Margaret. Hi, Lori, double R. Awesome. Got a few people on tonight wanting to learn about this very important topic. Anytime you say the C word, you get this kind of this anxiety, right? You get kind of like this feeling of like people cringe when I talk about cancer who don't really understand it. I used to be so afraid of cancer, like literally afraid. And then when I got it, ugh, but when you really understand what it is, you can take authority over it. You can start to do something about it. And what I know now, if I would have known now if I would have known back then before I got cancer and what I know now, it would have been totally different experience. However, I do believe that I went through cancer for a reason. And when I went through cancer, I learned in that period of time, I learned more in that year or 2 years that I was kind of dealing with it than I have learned my entire health professional life. And I've been studying nutrition and I've been in this industry for a long time. And I've studied diabetes, I've studied fibromyalgia, weight loss is my area of expertise. I've studied physiology. I mean, I've studied a lot of stuff, but never cancer until I got cancer. So I do think that for me, although at the time I didn't understand, I do understand now that I was supposed to have cancer so that I could be a better coach, a better teacher, so I could teach others how not to fear it, and also to teach others who do get cancer to give them encouragement and to help support them and to really make sure that they know that there's options. Okay, so now tonight's topic, it's for some of you, it might be very controversial, but here's what I'm going to say right now. I'm going to share my story. I'm going to share the facts about what I did. And I just want you guys to be open to hearing the other alternative. You guys are never given any opposing viewpoints on health. You are only given the medical allopathic perspective, which is fine because there's nothing wrong with certain aspects of medical allopathic medicine. Oh my word. Thank goodness for doctors who do surgery, trauma care, and infectious disease. Thank goodness. Praise God. I mean, amazing. Okay. But you also have another side of medicine called naturopathic medicine. And that naturopathic medicine is very powerful in prevention. Allopathic is not prevention. Allopathic is treatment. It's trauma. It's surgery. It's if you get in a car accident, if you have a gallstone, if you have something that's happened that you need immediate care, that it's treatment. Naturopathic medicine is preventative and it's healing and it's creating balance in the body. So that is what this group is all about. That's what I'm all about. So what I'm here to do is to always give you guys the perspective of the naturopathic side. Okay? That's all I'm doing. And so you guys have to be able to, take the information I give you and apply what you want and don't apply what you don't want, I guess, right? So tonight, we're talking about cancer, and we're talking also about how diabetes and being overweight are similar to cancer. And you're like, what? How can that be? Well, I'm going to show you, because when you really break down any disease in the body, any symptom, any disease can be boiled down to just pretty much a couple things that are going on in your body. The key is, and this is what physicians aren't good at. Physicians are amazing at diagnosing, but they're not amazing at prevention or helping you cure. It's just a different it's just a different philosophy, okay? So when you already have the disease, when you get the diagnosis, sometimes the diagnosis has so far gone that it's really hard to even do any of the naturopathic remedies, to get ahead of it. However, sometimes when you get diagnosed and it's just the beginning of a disease and you start with the naturopathic remedies, they work amazingly. This is why cancer treatments get the holistic side of cancer gets such a bad rap, because most people, when they get diagnosed, they're stage 4, stage 5, right? I mean, not 5, stage 4, stage 3, late stage 3, stage 4. And even in that scenario, I've seen many stage 3 and 4s get reversed. But when they're that progressed, sometimes it's just harder to totally reverse them. You might be able to get better, and you might be able to feel better, and not end up getting chemo and radiation and dying. But sometimes it can't be reversed. So now I'm of the position that I have seen amazing things with naturopathic nutrition and naturopathic medicine, like including myself. I mean, I had cancer. I was diagnosed with Hodgkin's lymphoma, and talk about somebody who's healthy, who I thought, who ate right, who exercised, to practice what she preached. I mean, I didn't overeat, I didn't drink, I didn't take drugs, and I got cancer. How does somebody like me get cancer, right? So that was really confusing to me. And I was like, if I can get cancer, then anybody in the world should be able to get cancer, right? I mean, if it was easy for me to get cancer, I'm very careful about it. And so this is what I want to teach you guys. I want to talk with you guys about tonight, because you don't want to mess around with cancer. And there are some things that you can do, like now, to be preventative from cancer forming in your body. There's things you can do now. I still do many of the things that I did when I was trying to reverse my cancer. Okay. So again, we're going to talk a lot about that tonight. And we're going to talk about, there's a lot of you in this group who have diabetes or prediabetes or are overweight or have fibromyalgia. And you're thinking, well, that's not cancer. No, it's not cancer, but it can lead to cancer. Cancer is kind of like the next step, possibly, because there's a few underlying things that are going on with somebody with diabetes and somebody who's overweight and somebody with fibromyalgia that can lead to cancer. Does it always lead to it? No, but there's an underlying thing that's occurring. And if you have diabetes or you're overweight, you have fibromyalgia, you have inflammation. If you have inflammation, you're a ticking time bomb to potentially have it brew to get cancer. I mean, that's just the reality of it. Okay. So what we are going to do is, first, I got to do a disclaimer, especially because we're talking about something very serious tonight. And again, remember, I'm not diagnosing any of you guys. I can't. I'm not a medical doctor. I will never diagnose you. However, once you get a diagnosis, and if you can use any of this information that I teach you to either start applying it or check with your medical doctor and start applying it, then there you go. It gives you an opportunity to start doing your own due diligence. It gives you the opportunity to start having these discussions with your doctor, or find a naturopath. That would be my advice, because it's never just one thing. If any of these things are off, you're going to have a disease or not feel good or have a symptom. If you have inflammation, you're going to have symptoms for sure, and you're not going to feel good. If your hormones are off, you're not going to feel good. If you're stressed out, it's going to turn into something chronic. If you're sedentary, if you have a really bad mindset, I call it stinking thinking. Like if you're chronically have a terrible mindset and you're negative and grouchy and crabby and angry all the time and have resentment and not forgiveness, all of that's going to cause an imbalance in the body. Also, if you are not nutrified, you're not eating the right things, and you're on a lot of medications, all of that is going to cause imbalance in the body, okay? And so it's never just one thing. I get that question a lot where people will say, well, that's what I said. Like, I was like, how did I get cancer? I mean, I looked at all these things. I was practicing what I thought all of these things, right, on this list. Like, all of these things I was pretty good at, except for two of them that were really way off. And so I'm going to talk about that, okay? So here's my story. Real quick. The reason why I decided to write 2 best-selling books was because I wanted to get the word out to women who are struggling. And a lot of the women that I work with are very smart. They're smart, intelligent women that are very, they're go-getters, right? They're great career women. They have families. They're really busy. They live life with passion, but they end up getting sick. Why? Why do they get sick? I seem to attract women like myself, right? Who are like, think we're doing the right things, but we don't know what in the world's going on. Why in the world did I end up getting sick, right? So when I got cancer, I was able to learn. I took my education to the next level. I became educated in cancer and became an expert in cancer. And then that just made my my expertise in diabetes even better, because, when you can learn about cancer and what the imbalance is and what causes cancer, it just, everything else seems, like easy. I don't mean to trivialize that. I don't mean to make it sound like, oh, if you have diabetes, that's simple, but it really, diabetes, you guys, is a nutritional disease. Okay, except if you have type 1. Type 1, well, I'm not talking about type 1. But diabetes is a nutritional disease caused by an imbalance. So is obesity. So is fibromyalgia. They are all very similar. And cancer is just an aggressive imbalance in the body, and your body's not working right. Okay, so when you take a look at our bodies as a whole are brilliantly designed. I mean, really think about this. Think about when you were conceived, right? When you were a baby in your mother's womb, your body knew how to grow you. Your body just knew. The intelligent design of the body is amazing. It knew how to grow in the body. Our bodies, the mothers know how to deliver the baby, right? The baby comes out and it knows how to breathe, and then the mom produces milk. I mean, it is amazing how the body works. We breathe without thinking about it. We blink our eyes without thinking about it. When we get a cut, our body heals itself, right? It automatically will heal the cut if we cut ourselves. It's just, we sleep and then we wake up. I mean, it's amazing how our bodies are designed. So there's some intelligence within the body. What happens when we get sick is we are not giving it what it needs. There's an imbalance in the body, okay? And that's where the research has been super powerful and super informative over the last at least 10 years, because we are learning now exactly what kind of fuel the body needs in order for it to run properly. Now, in the medical doctor arena, that's not their area of study, because in the medical allopathic arena, their area of study is trauma care. Their area of study is, if you are really, really, really sick and you need a medication, then let's go to a doctor for medication, okay? But if you have an underlying condition like heartburn, or you got a pain in your side, they're gonna do a CAT scan, a CT scan. They're gonna ask you your symptom, and then they're gonna look in their book and they're gonna say, what kind of medication do you need? That's just what they do. They diagnose and they put you on medication. Okay. That's just what they do. So what we do on the holistic side is we get the diagnosis from the doctor if it gets that far. If not, we look at your symptoms and then we figure out what is it that's imbalanced in the body. What's going on? Because our bodies are, when we give our body what it needs, it will fix itself. It's crazy. It will heal itself. I am a perfect example. I had cancer. For 9 months, longer than that, for a year and a half, I studied cancer. I reversed my cancer, and I have, I have a PET scan to prove it, and I got a medical report to prove it, that my cancer was gone in 9 months with the treatments, the holistic treatments that I write about in this book. Because I researched and I learned and I did whatever I needed to do to not do chemo and radiation, because I did not want to put that poison in my body, because I know from my research, I know what chemo and radiation does to people. People will die from the chemo and radiation before they die from the cancer. Now, again, remember, we're talking here about, we're talking about what we want to do. We want to be preventative, right? So those of you in this group who have diabetes and fibromyalgia and you're overweight, we want to get you on a cancer prevention protocol, which is similar to a diabetes protocol, actually similar but different. And you have to make that decision whether or not you decide. You have to get the diagnosis from your doctor, and then you have to decide, what route you want to go. But here, before we move on here, here's one thing I want to say about cancer before we start breaking it down and talk about diabetes and all that. Here's the only thing I want to say. If you haven't heard anything I said so far, here's what I want to tell you, okay? If and when you get a diagnosis of cancer, okay? I understand the fear. I understand how scary it is. Trust me, I was there. I had an emotional meltdown. I was so sad. I was so angry. I was so scared. But knowledge is power. When I decided, hey, you know what? This is what I'm dealt with. This is what is happening. I can't change the fact that I have cancer. I can't change it right now, but I can do something about it. So what am I going to do about it? I'm going to try something. And so what I did is I went on massive action to learn about what I could do to heal it naturally. And then when you get knowledge, and this is what this group is all about, I want to give you knowledge. I want to give you information so that you feel empowered to start taking your health into your own hands. When I did that for my cancer, I blocked what everybody else said. You guys, listen, you guys know it's going on right now in the world with everything that's going on in the world with opinions. It doesn't matter what other people think of you. You do what you want to do, but do your research. With cancer, what I did is I did my research. I did both research. I researched chemo and radiation, and I researched holistic. I researched both equally. What's happening with all of you guys, I don't care if it's the vaccine, I don't care if it's cancer, I don't care if it's diabetes, you're not researching both sides. You're getting one perspective. You're getting the allopathic side only. And that's the side that's the strongest because the most money is put into it. That's the side that is screaming at you the loudest, saying, and they're trying to scare you. They try to scare me into doing chemo. You guys, read my book. I share a story of me walking into that oncologist's office and her scaring me and telling me I should start doing chemo next week as she started to talk to me about what wigs I should be getting. I mean, they are going to scare you to death. That is what they do. Okay. So now, is it normal to feel scared? Absolutely. But what I am saying for all of you guys, when it comes to your health and you get that bad news, whatever the bad news is, whether it's cancer, diabetes, heart disease, whatever, cholesterol, blood pressure, whatever it is, take that information and research both sides before you just let them put you on 50 medications. Research both sides, find somebody that can help you. And then once you've done the research on both sides, then you decide. Does not matter what other people think. You decide what it is that you want to do, what's best for you. And for some people, might be doing chemo. I'm not against chemo for all cancers. I'd say 89, 90% of them I am, but I'm not. Because again, when you do your research, you will find that there's certain cancers that, because, let me give you an example, and this is the only example. Chemo doesn't kill cancer cells. Let me say that again. Chemotherapy does not kill the cancer cells that are in the body. They're called circulating tumor cells. What chemo does is it shrinks the tumor. So if you have a large mass in your lungs or in your throat, and it's causing you not to be able to breathe, and they can't do surgery on you because it's in the area where they can't, then chemo, yeah, you want to do chemo because it's going to shrink the tumor so you can breathe. Okay. If you have a tumor that's blocking your colon, so you are backed up and there's no other way, it's an emergency traumatic trauma situation, and you've got to get that blockage out, yeah, then then chemo is your answer. If you can't have surgery, right? Of course. That's the only time I am for chemo, because I know what chemo does. Chemo shrinks the tumor. It doesn't kill the circulating tumor cells, which we all have. But you know what kills your circulating tumor cells? Do you know what kills all those cells in your body so they don't become tumors? They don't rest in your liver. They don't land in your lymph system like mine. They don't land in your breast tissue. They don't land in your kidneys. They don't land in your liver. They don't land in your colon. Do you know what kills all those circulating tumor cells so they don't grab onto an organ and get bigger? Your immune system. Your immune system. Our immune systems are amazing if they're treated correctly. So let's get started. Okay, kind of went off on a tangent there, but I was going to get to it anyway. Okay, so what is diabetes? So real quick, diabetes is when your body cannot manage its sugar properly. Okay, what is obesity? Obesity is, again, your body cannot burn fat. The hormones in the body, there's something wrong with the body where it can't metabolize and burn fat. Okay, you hear a lot of times of women who are obese, and they say, well, I never eat anything. I hardly ever eat anything. They might have eaten their way to get big, but then once they are so inflamed and they've gotten a diagnosis of obesity, I've had many women say to me, I eat one time a day, but I can't, my body is obese. It won't come off. Okay, well, you've broken the systems in the body. The body is so unbalanced, it can't do what it's designed to do, which is burn fat. Okay, so diabetes, your body cannot manage food and break down and push sugar into the cell like it should. It's a mismanagement of how your body breaks down sugar and stores it. That's what diabetes is. You don't have diabetes because you lack insulin. You don't have diabetes because you don't have a pancreas. You don't have diabetes because you lack metformin. Okay. I will say real quick, type 1 diabetes, thank God we have insulin, because type 1, if you're born with type 1, that is hereditary. Type 1 is hereditary if you're born with it. Okay. That's where your pancreas doesn't produce insulin. So thank goodness in that case, thank goodness we have insulin medication. But what's happening now is all of your doctors are putting you on insulin when you don't need to be. Insulin is not going to fix the underlying problem of your body not being able to manage sugar. What insulin is doing is just cramming more sugar in areas that are already too full, which is why you're getting bigger and why you're getting worse and why your blood sugars aren't going down. So diabetes is a nutritional disease with an imbalance in the body. That's what it is. Obesity, same thing. It's an imbalance in the body. Your body doesn't know how to burn fat because it's so out of balance. That's what it is. Okay. When you overeat, okay, there's 2 reasons why you overeat. I did a class last week. Those of you who want to learn more about this, I did a class last week on overhunger and overdesire. Okay. If you have diabetes, it's because at one time you overate. You had too much food. And It's caused by overhunger or overdesire. Overhunger is a deficiency and a hormone imbalance. Overdesire is an emotional eating and a brain thing. Watch my class I did last week. It was amazing. It was on cravings. I go into more detail on that. So what is cancer? Cancer is your circulating tumor cells duplicating, latching onto an organ, and creating a tumor. Okay, there is something in our body called circulating tumor cells. We all have cancer in our body. Isn't that crazy? We all have cancer in our body. But what causes cancer to actually grow? It's your immune system. So my story is, although I thought I was doing everything right with my immune system, there was two things. One thing in particular I was not doing very well. And after my research, I realized that this is why I got Hodgkin's lymphoma. Stress. The number one suppressor of your immune system is stress. High in number two is a deficiency. So I had stress and a deficiency. My body was very deficient. And when you're stressed, this is why they kind of intertwine, because when you're stressed out, your body depletes certain vitamins and minerals. And if you don't replenish them and you don't know what you're deficient in, your body breaks down. So I was extremely stressed. I had, well, you can read in my book if you ever want to know about my stress, but there was a period of about 8 years where I was extremely stressed. I mean, I'm talking like relational stress. I'm talking financial stress. I'm talking lawsuits. I'm talking business. I mean, it was like an 8-year period where I was just like, I gained 30, 40 pounds. In that 8 years, I got adrenal fatigue. My body was just, it was not healthy. There was way too much stress in my life. So my body broke down. My immune system was unable to kill the circulating tumor cells, and I got cancer. That was a wake-up call for me. And when I learned about that, I was able to do something about it. I was able to do enough about it where I was able to shift and create balance in my body. What do diabetes, cancer, and obesity all have in common? The underlying root is you have a weak immune system and you have a nutrient deficiency. These two are the two things that are underlying every chronic disease in the world. Right here. Unless it's something that you were born with and is hereditary. I'm talking about if you are, became 20, 30 years old and all of a sudden you got diagnosed with heart disease, all of a sudden you got diagnosed with high cholesterol, all of a sudden you got diagnosed with, a tumor, all of a sudden you got diagnosed with diabetes. These are the reasons. Right here. Your immune system is weak and you have a nutrient deficiency, many of them actually. And here's the good news. We can do something about that. We can do something about the weak immune system and the nutritional deficiencies. In the holistic world, in the naturopathic world, we know how to do this. We build up the immune system, and we find out what your nutritional deficiencies are, and we plug in the gaps, and we build balance in the body. Those 7 things I shared with you at the beginning where, it's never just one thing. You guys hear me talk about that a lot because it's never just one thing. These 2 are the underlying root reasons, but you also have to work on those other 5 things. But you always, always, always come back to the 2 things where is your immune system weak? It's probably weak because you're stressed. It's weak because you have inflammation. Your immune system can be weak because you're going through perimenopause or menopause, and that's causing stress on the body, which then can weaken the immune system. They're all related. It's never just one thing. This is why we have to work on the body as a whole. This is why I call my academy the Lifestyle Academy, because we have to work on all of those things. And you guys, listen to me. I figured it out. I know how to do it. I know how to do it. I know how to help you with diabetes. I know how to help you with high blood pressure. I know how to help you with cancer. I know how to help you with high cholesterol. I know how to help you with fibromyalgia. I know how to help you. I just had a gal in my academy who came to me 3 months ago, diagnosed with stage 3 kidney disease. We just got her labs back. Her doctor said that he didn't think she had kidney disease anymore. 3 months. Why? Because she took the control, made the decision to take control of her health. And 3 months later, her body is healing because she's creating balance in the body. You guys have access to do this. Okay? You guys have to understand that you have more power than you think. But you got to do the work. And is the work easy? Yeah. I don't know. I mean, people ask me all the time, well, it must be so hard. Yeah, it's hard, but listen, it's also hard, being 50 pounds, 60 pounds overweight. It's also hard having to prick your finger every day to read your blood sugars. It's also hard to have to walk into your doctor's appointment and have them tell you you're a failure and put you on more medications because they blame it on you like it's your fault. When it's not, it's their fault. It's your doctor's fault for not helping you. It's not your fault. You trust them. They're supposed to know what to do. They don't. So is that hard? I think that's harder than actually learning how to fix your immune system, learning what your nutritional deficiencies are, and creating balance in the body. That is what you got to do. And that's why diabetes, obesity, cancer, all of those diseases are very similar because they all have that underlying root problem going on. So why do deficiencies, look at that. Typo. Patty, you on? Where's Patty? Yeah. I find typos all the time, so I apologize. I'm typing these things so fast. So I understand there's no end, so I apologize. But why do deficiencies occur? Our food supply. Our food supply is depleted. They are robbing our food of all of its nutrition because the soil now is sprayed with all of these pesticides, and our soil is depleting of its minerals. So the minerals aren't putting into the plants, and then they're putting all these pesticides and chemicals on the plants to try to, kill all the bugs, because again, they want to mass produce food, and they're genetically modifying all of our food. And when you eat that, you're putting not only those chemicals and those poisons in your body, but you're also not getting the nutrition you need. Okay? Our vegetables are depleted. Our soil is depleted. We got hybrid vegetables now. I mean, you go look in the grocery store, you guys, and you'll go look at the apples. Let's say you go and look at an apple in the grocery store. It's about this big. Or it's about this big. Okay? Then you go to the organic section, and you'll see the same apple about this big. Okay. Why is that? When you go to the grocery store and you see these big fruits and vegetables, and then you go to the organic section and they're half the size, that's why. Because they're pumping stuff into the seeds and the soil to make these things mass produce, just like they are with our animals. They're pumping human growth hormone into the chickens, into the beef, into the cows, into the pigs, and they're trying to mass produce all of the meat, right, to make them grow faster. It takes, I think, I can't remember the exact. I think it takes 3 years for a baby cow to become a full grown cow, like 3 years or something like that. With what they do now with the injection of the human growth hormone and all the drugs, they're able to take a baby cow and have it fully grown in like 7 months. It's something like that. I have it written down somewhere. I just don't remember. But my point is that they're making these animals grow so fast, and it's so bad for the animals because they're in so much pain. Same with chickens. Like they cram these chickens into these mass-produced hen houses, right? And they have no area to even move, and they're pumping them in with all of these drugs, and they get so big, and then they can't move, and then their legs break, and then they're eating each other's feces, and they're all have infections, and it's disgusting. And then we go to the grocery store and we buy the food, and that goes into our body. No wonder why we are getting sick. No wonder why we're getting cancer, because all of those pesticides, they're doing two things. The chemicals, the pesticides, the hormones. You know that in our water, they've tested water, and there's so many antibiotics in our water. So you're getting all of this stuff through your food supply. No wonder why your immune system is weak, and you're getting cancer and you're getting diabetes and you're not able and you're nutrient deficient. Okay, so they're making it very hard for us to be healthy unless you know what to do. Okay, and that's why our weak immune systems occur. And you guys know this, but back when COVID first was released, they had a the stats were saying that if you have an underlying condition of cardiovascular disease, diabetes, and chronic respiratory disease, these are the top 5 diseases that are pretty fatal when you get COVID. Why? Not because of the COVID virus, because of the underlying condition of your immune system. Okay, you guys, this is the facts. Okay, there's nothing stronger. There's no vaccine that's stronger than your immune system. But a lot of people in the world have really weak immune systems, which is why they're scared and why they want to get the vaccine. I get that. Whatever, it's their choice. But I'm just saying, if you truly do the research and you truly understand how the body works, if you truly understand it like I do, and you build your immune system, like you build that army where it's so strong, there's no need to put any chemicals in your body that don't do a good of a job as what your immune system does. You guys, and I'm proof. I had cancer. It's gone. My immune system right now it'll kill anything. I am not afraid of, I work really hard every single day on my immune system, every day. On those 7 things, I work on my stress. That's huge for me. I had to work on my stress. I have to make sure that I'm on the right supplements. So I'm very efficient. I have to make sure that my inflammation stays in check. I have to make sure that I'm active. I have to make sure I'm getting sleep. I have to make sure my hormones are all balanced out. I have to make sure that I'm eating the right, foods, and making sure there's lots of foods that are anti-cancer foods and that are foods that are really healthy and nutrient dense. All of that. It's not that hard. The hard part is for a lot of people who don't know what to do, so they think it's overwhelming and then they don't do anything. And they just go and get medications and shots and but if you truly want to do this work and feel amazing, you've got to take the first step, and you've got to be the one that decides, hey, yeah, I want to do it the right way. I want to do it this way because I know the long-term benefits outweigh drugs. 80% of all diseases fall within these 4 categories. Look at all of these, right? Do you guys have any of these? Anxiety, depression, diabetes, high cholesterol, migraines, sweats, peripheral neuropathy, tinnitus, joint pain, arthritis, back pain, blood pressure, bone spurs, acid reflux, leaky gut, cracked heels, dementia. All of these, 80% of all diseases fall within these 4 nutritional deficiencies. And this is based on Dr. Wallach's research. Prescription medications is another thing that will suppress your immune system. Prescription medication will treat a symptom, but will not fix an underlying imbalance. If you don't fix an underlying imbalance, and high blood sugar is a symptom, high blood pressure is a symptom, high cholesterol is a symptom, arthritis is a symptom, joint pain is a symptom, headaches are a symptom, being overweight is a symptom, having cancer is a symptom. If you have a symptom, what do? You go to your doctor and you get a drug. That's not going to fix the underlying root problem. That's going to treat it. It's never going to cure it, ever. It can't. It can't. Your body is the only thing that can cure itself. There's your nutrition and your body, food and your body. Drugs treat. Thank God for some drugs, but how they're being used now is getting us sicker. Antibiotics. Do you realize that antibiotics kill your immune system? And they give antibiotics like it's candy. Every time you take an antibiotic, you destroy your gut, which is why so many of you are getting sick at the whim of a hat. You're just getting sick all the time. Why you have digestion issues, why you have, leaky gut, why you have symptoms, why you have diarrhea, why you aren't feeling well, why you have chronic fatigue, why you have fibromyalgia, because our health starts in the gut. And if your gut isn't working, very well, you're not even absorbing minerals and nutrition, you're going to not feel well and you're going to have more symptoms. Antibiotics destroy your gut. If you have bad digestion, you're not going to absorb anything that you even eat. We're depleted anyway. So you're either feeding disease or you're feeding your health. And this is what I want to teach you. Okay? Think of it like a car. I think if you guys could really compare your health to a car, this will make sense. You take care of your car. Let's say that you bought a brand new BMW and what would you do with that BMW? You go take it to the car wash, you wipe it down on the inside, you make sure that you put it in the garage at night, you give it the best gas, right? Like you make sure it's the high quality gas, you take it in for oil changes, you take it to the car wash, you make sure that everything is taken care of, right? You give it the right fuel. And what happens if an engine light comes on in your new car? What do? If an engine light comes on in your new car, well, you probably call your husband, hey, babe, the engine light's on in my car. What do I do? And you bring it to a mechanic, right? You don't sit and let the engine oil light stay on forever because something's going to break down. It could be your car could blow up. So you service it. This is the same thing with our body. Our body, when we have a symptom, it is a sign. The symptom is the red oil light engine, and it's because our fuel tanks are empty. We are depleted. There's two reasons. Our fuel tanks are empty, and we're putting the wrong fuel in, and this is why our bodies break down. Would you do this with your car? No, you would not let your car run on empty, and you would put the right fuel in your car. Why is it any different for our bodies? Okay? Think of it like a car. If the red engine light comes on in your car, it's the same thing as if you have a symptom. A symptom. Headaches, pain, high blood sugars, high cholesterol, blood pressure. That's a symptom. That's the red engine light coming on. Okay, that's many years of you not knowing what to put in it. It's many years of you, maybe you're eating healthy, but you're depleted because you might be eating healthy. It's not your fault. Our food is depleted. Our food does not have all the nutrients that our bodies need to run on. We need 90 specific essential nutrients every single day, and I can guarantee you are not getting them. I am. I want all you guys to feel as amazing as me. So you're either feeding health or you're feeding disease. So this is the 9 steps I write about in my book right here. Those of you who are wanting to do some preventative methods for cancer, these are the 9 steps I write about right here. I would absolutely get a copy of my book, especially if you've been diagnosed with cancer or you know somebody that has been recently diagnosed. Get them my book. And then you guys, any of you guys who want to just be preventative, read this book. It's going to teach you a lot about what you need to do to build your immune system. Okay? This is an amazing book. In this book, this is exactly what I did to cure my cancer. I wrote my protocol. My protocol was the refuse solution. The R is research. The E is environment. I made sure that I really understood what my environment was doing, what I put in, what I breathed in, what I put on my skin, and what I breathe, put on, and what I put in. That's your environment. I really honed in on that. The F is food. Made sure I put in all really high quality anti-cancer food. The U is I got right with God, man, because I was so stressed out. And for me, that's the only thing that helped me with my stress. The S, supplements. I made sure that I took supplements that I knew were going to help build up my immune system to make it stronger and directly kill the circulating tumor cells. And yes, there are supplements that do that. E, I eliminated my stress. And D, I detox every single day. I drank this anti-cancer smoothie every single day. And if you want a copy of this, you guys can look inside the Facebook group, because here's the deal. Inside this group, I give you guys so much information in this group. You guys get a free copy of this book. This in a PDF form. This book is inside the group. You can download it. You can download it. You can share it with your friends. You can do whatever. It's totally fine. If you want an actual physical copy, you can go to my website, terrydale.com. You can order one and I'll sign it and I will send it to you. You can do that too. But otherwise, get a free copy, a PDF copy. It's in the group. My anti-cancer smoothie is also in there. If it's not, I will make sure that you guys all get it. Okay. So this is what I did to reverse my cancer. It's all here. This is the manual. This is the book that I wrote to reverse cancer. Or for any of you who want to be preventative, an awesome book for you. If you don't have diabetes, if you're pretty healthy, you could still do many of these things in my book. I do many of these things still to this day. Just not as aggressive, right? But I still do many of these things. Look at this. Let me show you. Here's my medical mushrooms. Okay, these are actual mushrooms. Still take those. Kilobiotic. Take these. This is an awesome supplement that I take for being able to detox pesticides and chemicals out of my system. HCl, systemic acid. I mean, so I'm just saying, I got my CBD, you know what I'm saying? So I practice what I preach. Now, here's what I want to say to you guys. Some of you guys are going, I want to learn more. I want to know how to do all this. Awesome. Here's your next steps. Are you ready? I want to help you guys. I want to be able to look at your situation and say, hey, Gail, hey, Debbie, hey, Bev, what's going on with you, sister? What can I help you with? What's your doctor telling you? What's going on? Are you on medications? Do you have inflammation? What's going on? I want to be able to help you. I want to be able to take your situation and say, hey, this is what I think we should do. I want to find what part of your immune system is broken, and I want to find out what your nutritional deficiencies are and give you something to start with. And you guys have that available to you, because what I'm doing is I am conducting a camp this weekend. Okay. The reason why I do these camps is because you will get time with me. I can't help you over a Facebook Live. I can give you classes, I can educate you, but if you really want that one-on-one interaction, this boot camp is going to give that to you. Okay. Get inside my boot camp. Hurry up. It's this weekend. It's so going to be worth your time. And we're going to talk all about this. We're going to talk about your supplements. We're going to talk about your deficiencies. We're going to talk about your immune system. That's the whole weekend. You are going to, after this weekend, you are going to be able to get going on something to help you build your immune system and help you to create better balance in the body. That is what you are going to get from this camp. This camp isn't just to sit back, watch me, and don't do anything. This camp is an active camp. This camp is like you're going to get to work. And I'm going to show you something. You guys ready? This was my camp I did 3 months ago. Marta came to camp. Sorry, Marta, you're like, I can't believe you're showing me this picture. Well, too bad. Marta, this was Marta. She was at camp in April. 3 months. Oh, and by the way, her A1C was, I didn't give a chance to update the graphic, but to add to this, her A1C was at 6.9. Now it's at 5. 3 months. She was at camp. Her daughter, Raquel, 3 months ago, look at this, 33 pounds, 41 inches, 6 sizes. off 3 meds. They came to camp. They decided to take their health into their own hands. Jan. Sorry, Jan, I couldn't get a picture of you with your eyes open. Jan was there, 80 years old. Isn't she cute? Look at this. Her blood sugars, her symptom was high blood sugars in the 500s. The other symptom, she could not get weight off. Look at her now, low 100s, lost 12 pounds, 21 inches, down 5 sizes. Amazing. Pam, 3 months ago, look at her, 24 pounds, 24 inches, off 2 medications. Her blood sugars were in the high 130s. Now they're totally normal. 3 months she was at camp. Yolanda, 3 months ago, she was at camp, not feeling well at all. She shared with me last night, her doctor, when she started, had stage 3 kidney disease. Her doctor said that he didn't think she had kidney disease anymore. In 3 months, she has healed her kidneys by creating balance in the body. That is unbelievable. 17.9 pounds, 16 inches, off of 6 medications. 3 months. It's in your hands. I can only help you by you accepting my help. Okay? You accept my help, I'll help you. It's the only way I can help you. You have to accept my help. And I'm offering it to you. I'm giving you an opportunity to come to camp this weekend so that I can help you figure out where we can start to create balance in your body. That's what camp is all about. Okay? Both of the books are inside this group. Okay? They're both PDF downloadable copies. Okay? If you go to the group and you look under files, you'll see the PDF copies of the book. Also, when you join this group, if you gave me your email address, I put you on my VIP list, and I also emailed you a copy of my book. So if you didn't get that, make sure you're on my VIP list. Check your spam. That's all I got to say. Most of you who aren't getting emails is just because either didn't give it to me or you're in your spam. I'm in your spam folder. Okay. So download these books, sign up for camp, and take it to the next level so I can help you. I hope this helped. I really hope this helped to encourage you and also kind of give you a jump start to be able to say, hey, you know what? It's time. I want to go because I want you to get results like Marta and Raquel and Pam and Jan and Yolanda. Okay. And they all came to camp. So I can't wait. We have a bunch of you signed up now. I can't wait to see you. And if you sign up tonight, you will be receiving information from me very soon. All right, you guys, have an amazing night, and we will see you at camp. Bye for now.
I can't stop that. I can't stop that. I can't stop that.